Ladies and gentlemen, I'm Markus Kostrzewa. I'm acting as Senior Vice President for Innovations at Bruker. I'm responsible for microbiology and diagnostics, R&D, regulatory and scientific affairs. And I would like to introduce you today what is Bruker contributing in the fight against sepsis. Sepsis, we say, every minute counts. So it's well known now that the treatment is critical in the case of sepsis and that speed matters. So there is a lot of publications showing that the mortality clearly can be decreased by rapid treatment. Changing from an initial broad spectrum treatment to targeted therapy has a lot of benefits. It avoids the patient being exposed against aggressive treatment where not necessary. It increases efficiency. Risk of bacteria become multi-resistant is reduced, and the costs are also reduced by not applying intravenous antibiotics when not necessary. And in addition, also the negative effect is reduced that is given to a natural flora that is a protection for us. So rapid identification is very valuable. And to show you this, I will give you some examples, and I'll start with one example to a certain point. That's a study with results from University Hospital Crosshouse in Scotland. So a European study used to the European system that Bruker supplies. And it starts with a young man admitted to intensive care unit with severe chest infection. It was proposed to be a pneumococcal pneumonia, and the patient got some initial treatment according to this diagnosis. Next morning, a positive blood culture was obtained, which said, okay, there is obviously blood infection, and the gram stain said it's gram-positive streptococci. Well, that's in line with the initial diagnosis. So now think about what would have happened if you see the later result. But here I will interrupt and first describe our system and the benefits. MBT Sepsityper is the main system of Bruker in microbiology, based on mass spectrometry for identification microorganisms. How it works is that in the normal version, the standard version, a colony of agar plate is selected. This colony is transferred to a sample plate where it's overlaid with a matrix. This is a substance necessary for mass spectrometry. This plate is introduced into a mass spectrometer, a multi-top mass spectrometer, like here the MBT Sepsityper series. Spectra acquired from the sample, so-called fingerprint spectra that are characteristic for species. These spectra are compared to a large database, and by that, with pattern matching, the species identified. This is very rapid. It can be performed for near 200 samples in about an hour, and for a single sample, even in the time of 10 minutes. So it's really easy. It's quite fast, much faster than traditional techniques, very cost effective, and the quality of results has been shown to be comparable to DNA sequencing results. Now, we have expanded this application to positive blood cultures without culturing on agar plates. How does that work? By using a kit called the MBT Sepsityper kit, we are extracting by blood cell lysis bacteria or yeast from the positive blood culture, starting with 1 milliliter of the positive blood culture, adding lysis buffer, pelleting the surviving bacteria and yeast, washing the pellet, and then transferring the microorganisms on the sample plate instead of the colony of an agar plate. Alternatively, for better results, in case the first approach did not work, a simple extraction method can be performed and the extract can be spotted. And again, this is measured quickly in the mass spectrometer and compared to the database. This means you can have, after only about 7 minutes sample preparation, already an identification with a mass spectrometer. And that can really have a big effect on the patient. The sample preparation can be done for a single very urgent sample, but it also can be done in batches, like many hospitals perform one sample prep in the morning and the second later in the day. The system is on the market in Europe since several years, but just at the very end of last year, we got the clearance for the MBT Sepsityper kit US-IVD, so applicable now also for diagnostics in the United States. You see here the clearance letter, and we performed a clinical study for that at 3 study sites with 379 monomicrobial samples, as given here, and got an identification rate of about 87% with no false identification at all. The workflow now is like this: a positive blood culture that is obtained from a blood culture automat, and that can be from different bottles from different manufacturers. We validated quite a number of those from the main manufacturers. This positive blood culture is used for the sample extraction, preparation, as I described before. The sample is measured in the mass spectrometer and then compared to a large database. The MBTCA database, which is the database of the US diagnostic system, contains now 488 species, bacteria and yeast that can be identified. Very broad and from very different groups of organisms. So to show you that this matters, here's some interesting results from our clinical studies. In the 379 microorganisms that we have observed in the study, this was belonging to 67 different species and 31 different genera. Think about what a diversity was observed. And now compared to 20 or 30 species that are sometimes thought to be enough. The 3 most frequent species, of course, covered more than 50% of the samples, but 37 species were detected only with 1 single isolate in this study, and 8 species only 2 times. 3 species were even not in our big cleared library, and 3 samples could not be identified at all because they were obviously not described and sequencing could not help. So I think this clearly shows how valuable a broad coverage of species is. What are now the benefits of the system? And there is quite some experience since years from Europe. I'll give you some examples. The shortened turnaround time needs to accelerate the prescription of the right antimicrobial treatment. And that, of course, helps the patient. Thereby, it could be shown that mortality could be reduced and also contaminants could be removed and not treated very quickly. You see the citations here from European hospitals and researchers that have published about that. Further benefits for the patient. The faster identification increases the chance of de-escalation and reduces the unnecessary exposure to broad-spectrum antibiotics. Earlier treatment corrections are possible, and that can be really life-saving. It also allows an earlier change from intravenous to oral therapy. And also important, the average hospital stay can be reduced for both gram-negative and gram-positive infections for emergency room sepsis patients. This all has been reported by Rushana Hussain from Royal Bolton Hospital, United Kingdom, in 2016 at the European Congress of Clinical Microbiology and Infection. So further benefits also for the hospitals and the wards. You see here the reduction of hospital stay that can be achieved by introducing the Sepsityper identification with multi-biotyper. It was calculated by Rushana that about €500,000 per year, based on 900 positive blood cultures per year, can be saved by that. The admission of patients to intensive care units was cut by nearly a third. And the intravenous antibiotic treatment could also be reduced by about a third due to identification in time of contaminations. So besides the patient benefits, there are also clear benefits on costs, and that for the whole hospital and the wards. Now let us come back to the case study that I've presented in the beginning. Remember, the initial diagnosis was pneumococci. The treatment was accordingly, and gram stain of the positive blood culture at the next day also was, well, gram-positive streptococci, that's in line with pneumococci. Luckily, the hospital performed Sepsityper analysis with multi-biotyper. And the result now was very different. Identification resulted in Streptococcus pyogenes, another pathogen that needs clearly another treatment. So therapy was changed, and clearly that might have saved the life of this patient. That's what the hospital claimed. So 24 hours earlier than any culture would have allowed the change here, the therapy could be changed. And this was probably life-saving and for sure very beneficial to the patient. I think an impressive example how the system can help the patient and also, of course, the hospital at the end that can rescue this life. Another, I think, also very important study, again from the University Hospital of Crosshouse of Scotland. A 20-year-old woman after a cesarean section came to the hospital, and her wound was red and somewhat inflamed. So blood culture were taken. Now, next day, there was a positive anaerobic blood culture body. But looking at gram stain under a microscope, there was no microorganism. So you could now think it is a false positive. We all know there are false positive blood cultures. Luckily, the hospital performed Sepsityper analysis. And the Sepsityper identified a Fusobacterium nucleatum. This again, of course, led to correct treatment. And the patient got the right treatment at least 40 hours earlier than if just the agar plate would have been cultivated and the slow-growing anaerobe would have been detected 2 days later. Again, clear benefit to the patient. And this was not only reported in Europe, but also similar reports are coming from the United States, from early adopters, like I show 3 of them here, that have introduced the researchers' only version of the multi-biotyper and MBT Sepsityper to their practice by self-validation. Like Ike Northern, Dr. Sheeran, and Dr. Burdett, the experience was always positive by reducing time to result, being cost-effective, having a better turnaround time in the hospital and the ward, conserving thereby healthcare resources, improving patient outcome by narrowing this antibiotic treatment down to the necessary, adopting it to the right treatment, escalating where necessary, de-escalating where possible. So to summarize this, what are patient and hospital benefits of MBT Sepsityper solution with multi-biotyper? For the patient, it's clear early identification allows a more efficient communication of the microbiologist with the correct result in time with a treating physician. In many cases, then, antibiotic therapy can be changed or even stopped. Mortality can be reduced and contaminants can be identified earlier. This leads also to benefits of the hospital. Less patients are admitted to intensive care units when not necessary. The treatment can be optimized clearly faster, and also alert organisms can be identified faster. And overall, the hospital stay of patients can be reduced, leading also to clear cost reduction. I hope I could demonstrate and convince you about the benefits of the multi-biotyper IVD system together with an MBT Sepsityper kit for sepsis patients, and I thank you for your attention.